So that gives us an opportunity for a question or two. If anyone has a question or comment from the audience, if you'd go to the microphone, and if there are none, I actually have a comment, and I have to say that each of you did an amazing job in addressing the topic from a little different perspective, so thank you very much. I kind of want to see the process of what Dr. Lee said and talked about with these centers of excellence in India, which are really very diverse facilities, starting from the rural community, reaching out into the camps in the community and bringing it up to the tertiary level, and bringing in what Dr. Murphy talked about with all these things, the right time, the right place, the right resources. Is it even possible to put those two pieces together?
So I would say actually we agree completely. And the Indian construct illustrates the application of Dr. Murphy's principles. And so what we're talking about is we would customize it for our US context. We wouldn't have that sort of rigid pyramid because we have a different society, a different culture, different expectations. But the principles that Dr. Murphy talked about are what makes all of those Indian systems successful. They have appropriately trained people doing the right thing in the right community context at the right time. They measure how they do things. They always continuously try to improve. They're now expanding to include general health, things like diabetes and other health issues because they're becoming a village and a community resource for health. And so I would say that that's an example of the application of her principles, and that therefore it's something that should inspire us to do something similar here.
I would just add one thing that, yes, I absolutely agree with you. The other thing is many of the systems and processes in place, we have to understand, work for the convenience of clinicians and payers and other systems. They don't work for the care and convenience of the consumer, clients, and patients. So, I think if we acknowledge that at the forefront, that's a good common ground for us all to have and think about perhaps reworking that a little bit.
The next group of speakers to the table. Dr. Bobby Pastrana will moderate the session on future directions for expanding the role. I'm sorry. I'd like to bring Mr. Bobby Pastrana to moderate the last session on future directions for expanding the role of public health to promote healthy vision and health equity. Thank you.